Fine.
Good morning. 22nd hand hygiene. My name is Jonathan and I'll be your nurse for today. I'm aware that you are unable to talk, so I'm wondering we can set a means of communications between you and I. Is it possible that we can do a thumbs up for a yes and a thumbs down for a no? Thumbs up, yes? Okay, perfect. And now what I'm going to do is I'm going to double check your ID. Can you confirm that your name is Billy Bob? Thumbs up, yes. Okay, can you confirm that your date of birth is 1974? Thumbs up, yes. Okay. Okay, can you confirm that... I noticed that there's no allergy band. Can you confirm that you have no allergies? Thumbs down. Yeah, no allergies. Okay, perfect. So I'm here today because I'm going to provide some trach care. So what I'm going to do is I'm going to suction your upper airway to remove some secretions. What I'm also going to do is I'm going to remove your in-ear cannula and replace it with a new one. I'm going to remove the gauze and assess the site, making sure everything is okay. I'm going to clean the area, top, bottom, and the plate. I'm going to replace and insert a new gauze. And then lastly, what I'm going to do is I'm going to replace the stabilizer that you have around your neck. Sound good? Thumbs up. Okay, have you had this procedure done before? Thumbs up. Okay, any complications in the past? Thumbs down. No? Okay. Are you in any pain right now? Thumbs down. No. Have you had any pain prior with procedures? Thumbs down. No. Okay. At any time during the procedure, if you have any pain, just raise your hand and that would be my cue that you're in pain and I will stop. Sound good? Thumbs up. Yes. Okay. Well, I'm looking at your vitals and I'm noticing that your O2 is down to a 92. Your respiratory rate is up to a 26. I'm also noticing that you have some labored breathing, and I'm also noticing that you are using accessory muscles. Are you having shortness of breath? Thumbs up. Yes. Okay. Are you having difficulty breathing? Thumbs up. Yes. Okay. So what I'm going to do now is I'm going to assess your lungs. I make sure to clean my stethoscope before coming inside. Okay. Take a deep breath. Deep breath. Deep breath. Deep breath. Okay. I do notice that you have some secretions. But don't worry, I'll take care of that. But other than that, your vitals are okay. Your heart rate and blood pressure are okay. Do you have any questions or concerns? Thumbs down now. Okay, so what I'm going to do now is I'm going to wipe the table for 30 seconds. And then we're going to let it dry for 2 minutes. Sound good? Thumbs up, yes. Okay, so while we wait for 2 minutes for let it to dry. I want to get you in a position of comfort, so I'm going to put you in a semi-fowlers. Are you feeling comfortable right now, Mr. Bob? Thumbs up, yes. Okay, what I'm also going to do is I'm going to give us some privacy and close the curtains. Also, what I want to do is I want to explain the emergency equipment that we have at the bedside. We have an ambu bag connected to oxygen running at 15 liters. We have suction connected to the canister running at between 100 and 120 milligrams of mercury. We also have two trachs, one of your size 8, and one size smaller, which is a size 6. And then we also have an inner cannula. Sound good? Yes? Okay, so what I'm going to do now is I'm going to gather my supplies. Okay, perfect. Now what I'm going to do is I'm going to make sure that the ambu bag is working. Yes, make sure that it's on. I'm also going to make sure to turn on the suction and replace the suction with a new one. I'm also going to test it out to make sure that it's working properly. Perfect, it is working. Now what I'm going to do is I'm going to hyperoxygenate you. Looks like this fell off. One, two, three, four, five, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Perfect. Next, what I'm going to do is I'm going to suction. This should take no more than 10 seconds in total. What I'm going to do is I'm going to insert the tubing for no more than 4 seconds, and then I'm going to withdraw the tubing, and that should take no more than 6 to 7 seconds. Sound good? Thumbs up. By the way, are you doing okay? Thumbs up. Okay, perfect. One, two, three. Perfect. Now 6 seconds coming up. 1, 2, 3, 4, 5, 6. Okay. Cover this. Now if I were to suction you again, I would make sure to wait for 30 seconds. And if I were to notice that you were in respiratory distress, I would also oxygenate you. So now what I'm going to do is I'm going to replace that inner cannula. How are we doing? Thumbs up, okay, perfect. So far so good, right, Mr. Bob? Yeah, I'm noticing your respiratory rate went down from a 26 to a 20, and your oxygen went from 92 to a 98. That's very good. I'm going to assess the site, make sure there's no redness, swelling, or inflammation. Make sure there's no discharge. So far so good. You in any pain? Thumbs down, no. We're almost done. I'm still monitoring your vitals. So far so good. Respiratory rate is still at a 20. O2 status at a 98. How are we doing, Mr. Bob? Thumbs up. Good. Okay. Perfect. Well, we just did the last part. I'm going to put this back on. So we're done with the first step. Now what we're going to do now is switch the stabilizer. I am going to call my colleague. Meanwhile, I'm going to put the bed at the lowest position. I'm going to put the call light right next to you. And I'm going to look at the vitals one more time. Make sure that everything is A-okay. And they are. Respiratory rate still at a 20. O2 sat still at a 98. Are you in any pain right now? Thumbs down, no. Okay, well, if you excuse me for a few seconds, I'm going to call my colleague. Sound good? Thumbs up? Yes. Perfect. Hello, Mr. Bob. I am back. 20-second hand hygiene. I also brought my colleague, Nurse Ben, right here.
Hello, sir.
I'm going to check your ID real quick again. Billy Bob, 1974. Perfect. So the last part that we have is we're going to remove the stabilizer and put a new one in. I'm going to explain the procedure real quick. I'm going to go. So we're going to do this one side at a time. Ben is going to hold the face plate while I remove this side. And then I'm going to hold the face plate on this side while Ben removes the other side. Sound good? Thumbs up. Okay, perfect. I'm gonna remove can hold that. Thank you. Okay, I'm looking at the site. There's no pressure ulcers, there's no redness or inflammation. I'm looking at the neck too. I see no pressure ulcers, redness or inflammation.
Nothing on this side either.
Perfect. And I'm going to hold it on this side. How are we doing, Mr. Bob? Thumbs up. Perfect. Okay, now we're going to make sure that it's not too tight by placing 2 fingers.
It's good.
Perfect. Okay, I'm going to throw this. Okay, lastly, what I'm going to do is I'm going to assess some vitals. I'm looking at the vitals right now. O2 is still at 98. Respiratory rate is still at 20. Are you having any pain right now? Thumbs down. Okay, that's good. I'm also going to do a respiratory assessment, so I'm going to listen to your lung sounds. And I'm going to document everything that happened. So I'm going to document that I changed the stabilizer and the inner cannula. I'm also going to document that there was no redness or inflammation. Can you breathe in? Breathe in. Breathe in. Breathe in. Perfect. Also, what I'm going to do is I'm going to document the amount of sputum, the color of the sputum, and the consistency of it. Lastly, what I'm going to do is that if this would be the end of my shift, I would change the canister and I would also change the suction. Do you have any questions or concerns? Thumbs down. Okay, perfect. Well, we are done. I'm going to set the bed to the lowest position. I'm going to put the collar right next to you. I'm going to put the rail up. And if you need anything, just hit the call light. Okay? Perfect? Thumbs up. Thank you.